Health CRP Strategy. The training modules. CRPs for Nutrition Center. Step 1. The external CRP conducts a survey to ascertain the number of pregnant women and lactating mothers and children up to 5 years in the village. Step 2. She compares the number of beneficiaries, pregnant women, lactating mothers, children enrolled in the Anganwadi center with the figures she obtained from her survey. Step 3. The external CRP conducts a meeting with the village organization representatives to explain the concept of community-managed nutrition-cum-daycare center. Step 4. The pregnant women and the lactating mothers enlisted in the survey are called for a discussion to ascertain the current status of their dietary patterns and their experiences, both the positive and the negative outcomes either during the delivery or after it. They are explained the importance of having a balanced diet during pregnancy and also during the lactation period. They are shown various options that can easily be managed at the village level, like the nutrition-cum-daycare center, tagged on with community kitchen gardens, weaning food preparations, etc. The cost of the diet provided at the nutrition centers is around ₹30 per day per person, shared by the beneficiary and the village organization. The village organization's contribution is dovetailed from government programs like the Janani Suraksha Yojana, ICDS, etc. The repayment by the beneficiary is done in easy installments. Having explained the process, now the participants are asked to further discuss the matter with their family members to obtain their permission to get enrolled in the nutrition center. Step 5. The external CRP along with the health subcommittee member also conducts a separate meeting with the mothers as well as the mothers-in-law to explain to them the need for a nutritious diet so as to obtain their consent to enroll their daughters and daughters-in-law in the nutrition center. Step 6. The external CRP along with the health subcommittee member also interacts with the men and explains to them the concept of nutrition center in order to get their wives enrolled in the nutrition-cum-daycare center. Step 7. Once the consent is obtained from the beneficiaries, the external CRPs will help facilitate the process of preparing the microcredit plans for the nutrition center. Step 8. The health subcommittee members will now send the proposal to the Mandal Samakhya to release the grant of ₹2,20,000 per village organization which has at least 15 beneficiaries enrolled with them. In order to focus on the POP, the project also provides ₹50,000 as POP fund specifically for nutrition centers. The CRPs contribute ₹10 per day, that is ₹150 per month since they work for 15 days every month towards the cause of the nutrition centers. This is their effort to promote social responsibility among the community to strengthen the nutrition center in their village. Step 9. The health subcommittee members responsible for initiating the functioning of the nutrition center procure the food commodities, draw out rations every day and hands it over to the cook, who is also an SHG member. Step 10. The external CRP supports the health subcommittee to set up a nutrition center in the village. She does so by opening the records and registers necessary for running the center efficiently. She also guides the subcommittee members in purchasing utensils, plates, and such other things essential for the center.
She also guides the health activist to prepare training calendar for 18 months, 6 months during pregnancy and 12 months during lactation period to focus on topics such as antenatal care, postnatal care, neonatal care, child care,
communicable diseases and Sukha Jivana Sutralu.
This training is specifically meant for pregnant women and lactating mothers who are enrolled in the nutrition center. In addition, the health activist is also expected to maintain record keeping at the nutrition center, for which she is paid additional monetary incentive.
Step 11. The SHG member, hitherto identified as cook, is sent for training at the Home Science College to understand the concept of balanced diet. At the college, she learns about the various methods of cooking so as to retain the nutrients in the food, especially the incorporation of locally available millets like ragi, bajra, jawar, etc., so very essential for a healthy diet. Step 12. The external CRP presents the plan of action and the progress made to the Gram Sabha. At this stage, she hands over the responsibility of running the nutrition center to the health subcommittee member. She ensures that all the POP and the poor are enrolled in the nutrition center, and the number of beneficiaries in the Anganwadi center and the nutrition center are the same. Step 13. The health subcommittee members visit the nutrition centers running for over a year. This could be either in their own district or in other districts. This is an exposure visit to learn about the various processes adopted to run the center successfully. In turn, they adapt them in their day-to-day work and strengthen the center to work efficiently.
Outcomes of Nutrition Cum Daycare Center. Development of beneficiaries enrolled at the centers as change agents in the village. Beneficiaries influenced the dietary practices at household level, SHGs, and in turn the entire community. Improved perinatal and neonatal outcomes. Safe deliveries. No low birth weight babies. Weight gain of mothers during pregnancy. Village Health Resource Center for regular interaction and counseling. Developing cook as a dietitian or counselor to influence improved dietary intake and usage of traditional foods in the daily diet. Regular usage of green leafy and other vegetables in the village. Reduction of anemia among women, adolescent girls and children. Reduction of expenditure on health.
The most important factor of the health CRP strategy is the health-seeking behavior for the community at large. For instance, the setting up of nutrition cum daycare centers was an innovative approach to deal with the lack of primary healthcare facilities in the villages. Since women could handle the basic requirements such as balanced diet for pregnant women, routine checkups, and daycare facilities for little children, this new model was a sustainable way out. Likewise, the practice of exclusive breastfeeding for the first 6 months, low neonatal and infant mortality rate, and many other instances where the innovation has contributed in transforming traditional health systems to primary healthcare facilities. In the next 5 years, the goal is to reach 1,000 villages by 2008-2009, 2,500 villages by 2009 and 2010, 8,000 villages by 2010-2011, the entire state by 2011-2013. The roadmap is to reach every nook and corner of the state with the health CRPs spearheading healthcare activities for a healthy future.